Microbiology at Cambridge. Sharon, thank you for everything you've been doing during the pandemic, and you're going to tell us about 561,000 viral genomes. So welcome.
Thank you very much. I won't be doing it one at a time, so it won't take too long. First thing to say, Ian, it's 16 degrees and sunny in Cambridge, so I'm sorry to tell you that, but I suspect that the view out of your window is probably better than mine. The second thing I would reiterate is really how incredible the team science has been in the UK over the last 18 months or so. I'd just like to echo what Ian has said. It's been a real privilege to be part of that. And I very much hope that going forward, that kind of unity across the scientific community, across different disciplines, continues to strengthen further. And I think meetings like this actually help that. So thank you to HDR UK for organising this important meeting. I'm going to be talking today about how we can improve health through enhanced data linkage to our UK SARS-CoV-2 genomes. Next slide, please. Now, genome sequencing of the virus really has become a vital part of our pandemic response. And we need to provide actionable information. And I've listed some of the things that we use that information for. So we need to reveal the patterns of viral introduction, for example, into the UK, and then onward transmission through community spread and hospital spread. We need to detect when variants of concern and variants of interest actually emerge. And then we need to map them to look at the distribution of variants. And that strongly informs policy and interventions. But we also need to monitor the effectiveness of vaccines and other interventions. We've seen that particularly recently with the Delta variant. And we need to use the genome data to then go back and develop new diagnostics, vaccines and therapeutics that actually keep pace with the speed of viral evolution. Next slide, please. So the generation of genomes in the UK has been made possible by the creation of the COVID-19 Genomics UK Consortium, which was built from scratch and was an idea generated in March 2020 when there were less than 100 diagnosed cases of COVID-19 in the UK. And so we started in April 2020. We established a distributed model of sequencing by bringing together 16 academic institutions across the country, the Wellcome Institute and the 4 public health agencies of the UK. The 4-nation working was extremely important to our principles. And we then networked that with more than 100 NHS diagnostic labs based in hospitals and together with the high throughput Lighthouse labs that were doing the community testing. So that's quite a challenge, and the necessary administrative and ethical frameworks were really developed by a team in Cambridge, where the logistics and ops teams are also based. So we had very generous access to the UK Cloud Infrastructure for Microbial Bioinformatics. It's a bit of a mouthful, but we call that CLIME, to house a custom data management system. And I think that this was one of the key elements to our rapid success when we first got going. Next slide, please. Now, COG UK has 4 main objectives, which you can see on the left in the circle. When we started, our first and foremost aim was to generate data for public health agencies so that they could take action on the basis of their findings. But we're primarily a research network and have undertaken really extensive research and development to improve sequencing efficiency and cost. We've developed tools that help to quickly analyse genome data in an automated way. And we've also undertaken basic research on viral evolution and transmission. Our other aims are to become increasingly integrated across the UK science ecosystem. I'll talk about that a bit more in a moment. And we're also supporting international sequencing efforts. So we have now generated over 500,000 SARS-CoV-2 genomes. That's around 10% of diagnosed cases in the UK overall since the start of the pandemic. And the sequencing capacity is divided into 3 different categories. The largest category is random community and hospital surveillance. So we have a good idea of what's emerging and what's being spread in the community. But we also use our sequencing to target public health actions, and we also support several key national studies. So our data has revealed patterns of viral introductions into the UK since the start of the pandemic. That's been very important to our UK border force. They've been used to investigate transmission and outbreaks in places such as care homes, prisons, universities and workplaces. And genome data are actually used daily to enhance contact tracing and surge testing. And we also sequence the virus in people infected for a second time or after vaccination to look for variants associated with immune escape. So COG data was used to detect the Alpha variant in the UK, and sequencing has since been used to detect many other variants of concern and interest, including the Delta variant. Now, we provide sequencing to several national studies, including the ONS study and REACT, and we're very fortunate to be able to support colleagues through genome sequencing. It's been a pleasure to do that. Just to note that all genome data are released into global public databases for other people to use, and so they can be used all over again. Next slide, please. So our first 18 months have really been focused on generating genomes for public health action and analyses, but looking ahead, we're now refocusing our efforts in new areas. This includes the development of COG International, which will develop online courses, train the trainer courses and virtual classrooms in SARS-CoV-2 sequencing, passing on the knowledge that we've gained in the last 18 months. But what I want to focus on here is our work to facilitate data linkage across the science ecosystem, which is being kick-started using seed funding from our original COG grant, but we hope will be followed by further funding. Next slide, please. So at the moment, we already link sequence data with sample data, which is uploaded into the CLIME cloud infrastructure. It then becomes linked to NHS numbers by Public Health England, but we're now in the process of migrating these data sets through into UK trusted research environments, where we're going to link this to detailed demographic data, electronic health records, and host genetic information. Next slide, please. So by combining viral mutations with host genomes, immune status, physiological measurements such as blood pressure and so on, treatment of patients and comorbidities, what we aim to do is discover new information on the determinants of COVID-19 susceptibility and outcome from infection. So we're moving from a generation of sequence data for public health action, which would be taken up now by Public Health England, into a discovery phase with these fantastic data sets that we've generated. So really, in summary, these genomes have been put to good use the first time round for public health benefit, and now we're going to go to a brand new level of analysis in support of discovery science. So thank you for listening, but before I close, I do want to acknowledge that around 500 people are members of this consortium, and they've contributed to the efforts of COG UK. Many are working as volunteers and have put their own work to one side to do that. And so my grateful thanks go to every member of the consortium. Thank you.
Sharon, absolutely fantastic. Ian, so we've got time for one or two questions, if that's okay, if that's agreeable with you. We have, Ian, one for you, one from Gila Nazari. How are we doing with standardization of how COVID-19 data are collected around the world, and what role is the UK playing in that? So,
well, thanks very much for the opportunity. I think the answer, to be absolutely honest, is mixed.